Duloxetine is more than just an antidepressant. Today, it has become one of the most commonly prescribed medicines for nerve pain. Many people know it by the brand name Cymbalta, but very few understand how it truly works inside the body. In this video, we will break down the 7 major effects of duloxetine, the good, the helpful, and even the risky parts. You will learn why doctors choose this medicine, how it affects nerve pain, and what changes you may feel while taking it. Before we begin, remember, this video is only for education. It is not medical advice. Always consult your doctor before starting, stopping, or changing any medicine. Duloxetine, also known as Cymbalta, is a medicine that belongs to a group called SNNR-IOS, or serotonin norepinephrine reuptake inhibitors. This means it works by increasing the levels of 2 important chemicals in the brain, serotonin and norepinephrine. These chemicals help control mood, stress, and how the body feels pain. Doctors use duloxetine for several conditions. It is widely used for depression and anxiety, but it is also approved for certain types of nerve pain, especially diabetic neuropathy and fibromyalgia. Studies published in trusted medical sources, including research from Mayo Clinic, PMC, and Biomed Central, show that duloxetine can significantly reduce nerve pain and improve the overall quality of life for many patients. Effect number 1. Pain reduction, especially nerve pain. Duloxetine is widely known for one big reason. It can lower nerve pain when many other medicines fail. Research shows that it helps people with severe nerve problems, especially diabetic nerve pain, feel real relief. Clinical studies on PubMed have proven that duloxetine gives meaningful improvement to many patients who struggle with burning, stabbing, or tingling pain. In several trials, a large number of patients experience 50% or more pain relief, which is a huge change for people who live with constant nerve pain every day. According to medical data, around 5 to 6 people need to use duloxetine for one person to get that major 50% improvement. And in the world of nerve pain medicine, this is considered strong effectiveness. Most patients describe it like a fog lifting, or the pain becoming less sharp, less intense, and more manageable. While it doesn't cure nerve damage, it reduces the painful signals that the nerves send. For many, duloxetine becomes the turning point that helps them function again and live without overwhelming pain. Effect number 2, improved nerve function. One interesting and lesser-known effect of duloxetine is that it may actually improve how nerves work, not just reduce the pain they send out. In one recent study on PubMed, patients with diabetic neuropathy showed better nerve conduction velocity, which means the nerves were sending signals more smoothly and more normally. This surprised researchers because most medicines only mask pain rather than improving nerve health. Patients in these studies said that their feet felt more awake, more responsive, and less numb. Some even reported better balance and fewer sudden shocks or stabbing sensations. While doctors still don't fully understand how duloxetine helps nerves recover, the evidence suggests it may support the body in healing or stabilizing damaged nerve fibers. This effect brings hope for people whose nerve pain usually gets worse year after year. Instead of only managing symptoms, duloxetine may help improve nerve function over time, something very few medicines can do. Effect number 3, mood and mental health benefits. Duloxetine is an SNRI, so it boosts serotonin and norepinephrine, 2 chemicals that control mood, stress, and emotional strength. Many people with nerve pain also face depression or anxiety, simply because living with pain every day drains your mind and energy. According to Mayo Clinic and several PubMed studies, duloxetine helps with both problems. It reduces pain and improves mood at the same time. This dual action is powerful. Patients often describe a warm, steady sense of calm returning after weeks of constant stress. They feel more motivated to move, think, and live their day normally. People with fibromyalgia or chronic nerve issues also report better sleep, less irritability, and more emotional balance. When pain goes down and mood goes up, life starts to look normal again. That combination, less pain, better mood, more energy, is one of the biggest reasons doctors choose duloxetine for long-term conditions. It's not just treating the body, it's helping the mind recover too. Effect number 4, common side effects. Even though duloxetine helps many people, it does come with noticeable side effects. Some of the most common ones include nausea, dizziness, sleepiness, constipation, and a reduced appetite. These appear in research from Biomed Central and NCBI, and they show up especially during the first few weeks of treatment. Many people describe the early nausea as a heavy, uncomfortable feeling in the stomach, often strong enough to affect appetite. Others feel groggy or spaced out during the day. These side effects usually get better with time, but for some people, they become too annoying to continue. Studies also show that higher doses cause more side effects, which means starting low and slowly increasing is important. Unfortunately, a number of patients stop the medicine completely because they cannot tolerate the discomfort. While duloxetine has real benefits, these early side effects can feel like a trade-off. Relief arrives slowly, but the discomfort shows up fast. Effect number 5. Rare but serious risks. Beyond the common side effects, duloxetine carries a few serious risks that people must know about. These are rare but real. According to NCBI and PubMed, duloxetine can increase the risk of suicidal thoughts, especially in younger people. It can also cause serotonin syndrome, a dangerous condition where the body is flooded with too much serotonin. There are also reports of liver damage, which means people with liver problems should avoid it entirely. Another risk is hyponatremia, or dangerously low sodium levels, which can lead to confusion, seizures, or even fainting. Doctors also warn about SIADH, a condition where the body holds too much water. Although these risks don't happen often, they can be serious if ignored. Patients with severe liver or kidney problems should not take duloxetine, as their bodies cannot safely handle the drug. These dangers remind us that duloxetine is powerful, and power always comes with responsibility. Effect number 6. Safety in specific patient groups. Duloxetine behaves differently depending on age and health conditions. In people with diabetes, studies show it does not significantly worsen blood sugar levels or cause major heart problems, which makes it a reasonable option for diabetic neuropathy. But in older adults, especially those above 65, recent research and even reports from The Guardian warn that antidepressants like duloxetine may bring more risks than benefits for certain pain conditions. Older patients may experience more side effects, more dizziness, and a higher chance of falls. Another important warning is about drug interactions. Duloxetine should never be taken with MAO inhibitors or certain antidepressants, because this can lead to serotonin syndrome, a medical emergency. People with liver or kidney disease also need special caution. Duloxetine is generally safe for many, but not for everyone, and doctors tailor the dose based on each person's age, condition, and medical history. Effect number 7. Withdrawal. Discontinuation effects. Duloxetine withdrawal is one of the most shocking parts of this medicine. Stopping it suddenly can trigger intense symptoms known as discontinuation syndrome. People describe these symptoms as frightening and overwhelming. Some report brain zaps, sudden electric shock feelings inside the head. Others feel dizzy, nauseous, or extremely emotional. One patient wrote that they had to remove one tiny granule at a time because the withdrawal was so unbearable. Another person said they became dizzy, overheated, sweating heavily, and almost fell because of the sudden imbalance. These stories shared on Reddit and other platforms show how powerful the withdrawal can be. This is why doctors strongly recommend tapering very slowly, sometimes over months, to avoid these harsh symptoms. Duloxetine does help many people, but stopping it must be done carefully. The body gets used to the drug, and removing it too fast can feel like a shock to the brain. A reminder of how strong this medicine. Duloxetine has 7 major effects you should remember. It can reduce nerve pain, improve nerve function, and lift your mood. But it also brings common side effects, rare yet serious risks, and special concerns for older adults or people with certain health conditions. And finally, it can cause strong withdrawal symptoms if stopped too quickly. Duloxetine is powerful, but it's not magic. It can help many people, but only when used with proper guidance. If you're thinking about taking it for nerve pain, always talk to your doctor first. Discuss the right dose, the possible risks, and the safest way to start or stop the medicine. If you found this information helpful, make sure to like this video, subscribe, and tap the bell so you don't miss future medical explainers. Do you or someone you know take duloxetine for nerve pain? Share your experience in the comments, but remember, never give or take medical advice from strangers online. This video is for education only. Always talk to your healthcare provider before starting or changing any medication.